Well, I think both are fundamentally important. I think at this point in the literature, whether it's more important to increase physical activity or to have an elevated cardiorespiratory fitness, I think the jury's still out on that. The weighted evidence to this point would suggest that cardiorespiratory fitness trumps or is slightly better at predicting cardiovascular disease and physical activity, but there is a major caveat in the literature. Cardiorespiratory fitness in those studies is an objective measure. We actually measure it, where physical activity is self-reported. And we know that self-reported has inherent bias, and that's a major limitation. So I don't think quite yet we're ready to answer that question definitively as to which is important. Now, of course, the major determinant of a cardiorespiratory fitness is physical activity. So if the health practitioner wants to improve cardiorespiratory fitness, then you're going to have to prescribe physical activity. So in the end, it may be moot to suggest which is better, the behavior, physical activity, or the trait, cardiorespiratory fitness. I think both are good. It's certainly true that mother and father have a lot to do with the level of cardiorespiratory fitness you have. That is certainly true. But a large proportion of cardiorespiratory fitness can still be influenced by physical activity. So I would suggest to practitioners that you do two things. One, measure physical activity and measure cardiorespiratory fitness. Prescribe a program intended to improve cardiorespiratory fitness, which could be a program consistent with current guidelines today, and then remeasure both physical activity and fitness upon seeing the patient or your client once again. One thing for sure, we can't know which is better unless we measure them. So certainly these two variables need to be measured in clinical practice, and I think that's the message right now that most of us researchers in the field would be the most happy with.